So in this video, we will be discussing about skeletal muscle relaxants classification. How do we classify skeletal muscle relaxants? So in order to understand the classification of skeletal muscle relaxant, broadly we should know what are the mechanisms which are responsible for maintaining the contraction of skeletal muscle. So one, the skeletal muscle is under the influence of central nervous system, and the polysynaptic reflexes coming from the central nervous system, they control the contraction. That means there will be one category of drugs which act in the center and they block polysynaptic reflexes, and that's how the muscle is relaxed. So one category of drugs are called as the centrally acting drugs. So centrally acting drugs, they inhibit polysynaptic reflexes, and that's how the skeletal muscles are relaxed. So this is the first category of skeletal muscle relaxants. So whenever we know that there is one centrally acting muscle relaxant, logically there would be other category of drugs which are called as the peripherally acting muscle relaxants. So one category is centrally acting, the other is peripherally acting. Now peripherally acting muscle relaxants, that means they act in the periphery. So at periphery, there would be two places where this drug can work. One is at the neuromuscular junction, and second is directly on the muscle fiber itself or the muscle itself. So now this peripherally acting muscle relaxant, they can be further subdivided into two categories. So one is called as the drugs which work at the neuromuscular junction, and the other category of drugs, they work directly on the muscle. So one category, drugs acting at the neuromuscular junction, and the second category is drug directly acting on the muscle, on the skeletal muscle. Now the drugs which work directly on the skeletal muscle, what is their mechanism? The skeletal muscles are contracted when the calcium is released. That means this group of drugs, they work by inhibiting the release of calcium. Where does this calcium come from? This calcium comes from the sarcoplasmic reticulum. That means directly acting skeletal muscle relaxants, they inhibit the release of calcium from the sarcoplasmic reticulum. From how does this calcium gets released from the sarcoplasmic reticulum? There is a receptor called as ryanodine receptor. So that means the drugs which directly work on the skeletal muscle, they inhibit the release of calcium from the sarcoplasmic reticulum through the ryanodine receptor. So they block ryanodine receptor, and that's how the skeletal muscle is relaxed. Coming to this category, at the neuromuscular junction. At the neuromuscular junction, there are three different type of categories of the drugs which work at the neuromuscular junction. Now at the neuromuscular junction, the junction that I am talking about is the junction where the nerve and the muscle, they are joined, and that's why it's called as neuromuscular junction. Now which neurotransmitter is released at this junction and what does it do? So the neurotransmitter which is released at that juncture or that junction is acetylcholine. Now you know that acetylcholine works on two types of receptors. One is called as the muscarinic receptors and the other is called as the nicotinic receptor. Now this receptor which I am talking about, these receptors are nicotinic in nature because they are present in the skeletal muscle or the junction of the nerve and the muscle. So the nicotinic receptors, they are of two types, NN and NM. NN type of receptors, they are present in the ganglion, autonomic ganglion. So the receptors which are present here, these are NM type of receptors. That means the drugs which block the NM receptor. So these drugs, they block the action of acetylcholine at the NM receptor. The second type of drugs in this category are called as the depolarizing drugs. Now we'll speak about this difference between what is the difference between the drug which act at neuromuscular junction, because they block the receptor and they block the action of acetylcholine, whereas these drugs they inhibit, they cause depolarization and they result in the relaxation of muscle. The third category of drugs, they are called as the other categories, and in this category there is one example called as the botulinum toxin. In this category there is an example called as botulinum toxin. So what botulinum toxin does, it inhibits the release of acetylcholine. So by inhibiting release of acetylcholine, this group of drug work, or the botulinum toxin work. So this inhibits the release of acetylcholine, botulinum toxin. Once the acetylcholine is released, then that acetylcholine is going to work on the neuromuscular junction. That junction is blocked by the drugs acting on the neuromuscular junction. Now because they work on the receptor, they are called as the competitive type of blockers. Competitive type of blockers. Whereas the non-depolarizing drugs are called as the non-competitive blocker. So remember, these are competitive, these are non-competitive. These are called as the non-depolarizing, whereas these are called as depolarizing. So you know, here there is a non, but they are depolarizing in nature. Here there is a non, but they are non-depolarizing in nature. So these are competitive, these are non-competitive. These are depolarizing, but these are non-depolarizing. So one non is here, one non is here. So now let's understand what is the mechanism of depolarizing type of drugs. This mechanism we understood. They block the action of acetylcholine at the neuromuscular junction, and the action of acetylcholine is blocked in a competitive manner. Acetylcholine was going to contract the muscle and that contraction is inhibited. So this is the competitive type of blocker, which is also called as the non-depolarizing. Now here the muscle relaxes because of the persistent depolarization. That means there will be initially twitching, fasciculations, that is the response of the depolarizing drug. Then there will be a flaccid paralysis. This is the depolarizing drugs. So the difference between competitive blockers and non-competitive blockers, the competitive blockers are non-depolarizing in nature, whereas the depolarizing drugs, they are non-competitive in nature. That means there is a persistent depolarization which is resulting in the flaccid paralysis. Now let's talk about the examples of the drugs in these categories. Number one, the centrally acting drugs, they are of different categories. One of the categories is called as the mefenecin derivatives. Mefenecin and congeners. Mefenecin is not commonly or not used as a skeletal muscle relaxant because of its toxicity. However, the examples of its congeners, they are used. Some of the examples include chlorzoxazone, carisoprodol, chlormazanone. So these are the examples of mefenecin and its congener. The second category in centrally acting muscle relaxant, the GABA, gamma aminobutyric acid, is an inhibitory neurotransmitter. So when the level or the action of GABA is increased, then that results in the muscle relaxation. So we have the GABA A type of receptor agonist. So GABA A agonist, and example of GABA A agonist is diazepam. The second example or next category is GABA B agonist, and we can know the example, or we can remember the example of GABA B agonist because this is B. So remember baclofen. This is the example of the GABA B agonist. Next category is centrally acting, because these are centrally acting drugs. Centrally acting alpha 2 agonist. An example of this is tizanidine. The next category is other drugs. Couple of examples in the other category. One is riluzole and thiocolchicoside. So this is the group of drugs which act in the center and they inhibit polysynaptic reflexes and they inhibit the skeletal muscle contraction. The example of directly acting skeletal muscle relaxants, remember it starts with D. So we know the example is dantrolene. The second example is quinine. Now dantrolene we have to remember for some special reasons. Number one, D for D. Dantrolene is a skeletal muscle relaxant. Dantrolene works by inhibiting ryanodine receptor and it's the drug of choice for the malignant hyperthermia. Malignant hyperthermia is a condition where there is a high fever because of excessive release of calcium resulting in excessive skeletal muscle contraction. So dantrolene is used for that purpose. Second example is quinine. So this is another directly acting skeletal muscle relaxant. This drug is not commonly used for skeletal muscle relaxation. It's an anti-malarial drug. The drugs acting at neuromuscular junction, the example of other drugs I spoke about, that was the example of botulinum toxin. So this is the example. The depolarizing drugs which are non-competitive blockers, the example is succinylcholine. The other example is succinylcholine is a depolarizing category of drug. So it causes flaccid paralysis. The other example is decamethonium. Now how to remember the name of decamethonium? We know the other name for succinylcholine is suxamethonium. Suxamethonium is also called as succinylcholine. So that's one methonium and this is the decamethonium. Now the drugs which are competitive blockers, the examples of the competitive blockers, one of the example is D-tubocurarine. Now this D-tubocurarine, the name has come from curare. When for animal hunting, some of the tribal people, they used to use the arrow poison and constituent of that arrow poison was curare and the active component is D-tubocurarine. So D-tubocurarine is the drug which paralyzes the skeletal muscle. The other drugs include, there is a drug called as atracurium, cis-atracurium. Then there is a drug called as mivacurium, rocuronium. So these are the drugs in the competitive blockers which are of non-depolarizing type of skeletal muscle relaxant. So this is the overall classification of skeletal muscle relaxants. Thank you.